I am very happy and glad to give a short and crisp introduction of our today's speaker, Dr. Rafeeque sir. Dr. Rafeeque sir is especially doesn't require any introduction because he has been very renowned at and he is taking care. He has been MBBS and MD in medicine, and he is a senior consultant physician and cardiodiabetologist, and he is a director of PART Hospital, Nanded. And he has a tremendous experience of more than 25 years now, and out of which he has 10 years of experience in ICU and handling a critical patient. And when it comes to the academics, it is a very strong point of the sir has been uh, participating in various national as well as international conferences. Like if you see about the national conferences, sir has been the part of Epicon, then Mapicon, CAD, and SIPS. And when it comes to the international conferences, sir has participated in APS 2013 in Japan and ADA 2014 in Australia. Sir has attended, across the globe, sir has attended the international conferences, and when it comes to the ESC conference, so sir has attended it in 2018 in the Germany, and sir has also presented 4 papers in the international journals. And when it comes to the patient awareness and feeling for his patients, sir has a very strong social media handles, like he has more than 4,600 followers on his YouTube channel and having more than 170 videos for his patients, and that is very patient centric. And if someone has not subscribed it, so I must recommend that he should go and check out this sir's video. They will find out in every topic that patient should know for his benefit. And when it comes to Facebook also, there are around 6,000 followers sir is having. So after having a busy schedule as well, sir is taking out his time to make a quality content for his patient, because most of the time patient does not in the condition to listen the patient or doctor in the cabin. So he can take out his time at home and he can see the educational videos of the sir. So that is a very strong thing, that very rare of the doctor is having this much of engagement in social media after having a so busy schedule. So heads off to you for this, sir.
Thank
And
you.
now, sir, currently sir is at Pulse Hospital, and he's a director here, and he's working as a senior consulting physician and cardiodiabetologist. So with this short introduction, I would like to hand over the session to Dr. Rafeeque sir to he will take us through Azelnidipine, a new CCV, and over to you, sir.
Thank you very much, Shahzad, for nice elaborative introduction of me. I welcome all the delegates on this meeting, and few of them must be watching me on this program is being telecasted on YouTube also live. So many my subscribers are following on YouTube also this event. So friends, the topic given for BEAT for today's webinar is about Azelnidipine molecule, which is a powerful, promising game changer of the present and the future in hypertension. So this is the title of today's webinar. We will cover this webinar under these following headings. We will see why hypertension is called a silent killer, what are the actual BP goals and guidelines, how the elevation of blood pressure and aldosterone leads to end organ damage, and what are the new calcium channel blockers which are beyond the conventional CCBs, especially focusing Azelnidipine, how it is having multifactorial action on heart, kidney, adrenal and nervous system. We will briefly review certain clinical studies pertaining to Azelnidipine and blood pressure, aldosterone, heart rate, pedal edema, benefits and all. Similarly, its role in diabetic patients also. And we are going to see advantages of Azelnidipine in comparison with amlodipine and other CCBs. Finally, we will see advantage of Azelnidipine in our Indian context, and we will summarize this meeting. So, this is my hospital, Pulse Hospital in Nanded, from where I am delivering this talk. My dear friends, hypertension is a major cause of premature death worldwide. We know this. And around 1.28 billion adults between 30 to 79 years worldwide, they have hypertension. And out of that, 46% of adults with this problem, they are unaware. This is the sad part of this disease. Almost 50% of the patient, in spite of having the disease, they don't know that they have this problem because of the silent nature of the disease, because most of the time it doesn't produces any signs and symptoms. This is the reason it is called silent killer, and it has been linked with the many disorders like heart attack, stroke, dementia, kidney failure and vision loss if not treated timely. So hypertension, that's why it is called as silent killer. In our country, you can see cardiovascular disease, they are the most prominent important causes of death and disability, and mortality has gone by 31% in last 25 years. And better hypertension control can prevent between 400 to 5 lakh premature deaths in India. And this problem led to 1.6 million deaths, more than per year what the COVID has caused the deaths, and most important cause of disease burden in India. So this hypertension is the most important risk factor for CVD in India. If you see the disease burden when hypertension is uncontrolled versus those patients who have controlled hypertension, the patient in whom the blood pressure is uncontrolled, they have the risk of end stage renal disease up to the tune of 95%, heart failure 88%, stroke 57%, coronary heart disease 44%, all cause mortality 30%, and peripheral artery disease 23%. So this is the huge amount of burden or the risk those patients who have uncontrolled hypertension they have. Then if you see the main factors that contribute to the development of this problem and its complications, so the social determinants and drivers are globalization, urbanization, aging, income, education and housing. Ultimately, they result into behavioral risk factors like unhealthy diet, tobacco use, physical inactivity and harmful use of alcohol, leading to certain metabolic risk factors like high blood pressure, obesity, diabetes and raised blood lipids. Finally, terminating into some target organ damage in the form of cardiovascular diseases, kidney disease, heart attack, strokes and heart failure. So if you talk about end organ damage in this problem, so they can be divided into 4 groups: vasculopathy, cerebrovascular damage, heart disease, nephropathy. Vasculopathy includes endothelial dysfunction, generalized atherosclerosis, aortic aneurysm, remodeling and arteriosclerotic stenosis. Whereas cerebrovascular spectrum includes acute hypertensive encephalopathy, stroke, intracerebral hemorrhage, lacunar infarction, vascular dementia and retinopathy. When it comes to heart diseases caused by uncontrolled hypertension, they include left ventricular hypertrophy, atrial fibrillation, coronary microangiopathy, CHD, myocardial infarction and heart failure. In the kidney group, it can cause albuminuria, proteinuria, chronic renal failure and mild acute chronic renal insufficiency also. If you see the overall cardiovascular risks associated with this problem, so you can see this is very wonderful slide. As the on the x-axis and on the y-axis, on the one axis the risk factors are shown, and on another axis the grade of hypertension is shown. As the number of risk factors they increase and as the grade of hypertension increase, the risk of developing cardiovascular event increases significantly. You can see those individuals who have normal blood pressure with no risk factor, they still have average risk of developing the cardiac events. 10% of probability of cardiovascular event within 10 years and 0% risk of cardiovascular death per 10 years. Slight risk 10 to 15% probability of a cardiovascular event within 10 years and less than 4% risk of cardiovascular death per 10 years. Moderate risk 5 to 20% and 4 to 5%. Significant risk 20 to 30%, 5 to 8% risk of death. Significant risk means more than 30% probability of developing cardiovascular event within 10 years and more than 8% risk of developing cardiovascular death per 10 years. So you can see as the number of risk factors increase and as the grade of hypertension increase, there is also increase in the risk. Suppose an individual has more than 3 risk factors and he has grade 3 hypertension, he will have very significantly elevated risk, means more than 30% risk of developing cardiovascular event within 10 years and more than 8% risk of developing death per year. On the contrary, suppose an individual has absolutely normal blood pressure with no risk factors. Excuse me.
minimize इसको कट करो minimize
Hello, can you listen me? Am I audible? Hello? Hello?
mouse
Some technical problem. Am I audible?
disconnect हो गया पासवर्ड क्या
कैसे क्या कैसे क्या
disconnect गया हमारा